I'm constitutional attorney Catherine Henry. My goal will try to be to bring information about the MDHHS mandates, which are here in Michigan, but quite frankly, the parts about the U.S. Constitution that I'm referencing and the general concepts of government apply the same to every single state in the U.S. So if you are in Florida or in Nebraska, or if you're in Wisconsin, you'll still be able to get something out of this presentation. Okay, so there's some new things I wanted to share. Not really new, but new in the context that I might not have specifically talked about in the last time I talked about this board. Number one, what are we talking about? What kinds of questions are people having? I can guarantee you that of all of you now watching, and those of you to watch later on, that at least half of you, if not 3/4 or more of you, have had these questions even recently. So I will reiterate the kinds of questions I'm talking about dealing with right now are dealing with contact tracing, microchipping, the COVID or even the flu vaccine, masks, social distancing, temperature checks, all of those pieces, all of those elements that we have seen in the MDHHS orders, or even in orders that have come out from our local health departments. And how have they done that? Well, here in Michigan, there are two main statutes that you'd want to look at if you're going to follow along with the Michigan Legislature's website. That would be MCL 333.2253. That is the one that gives MDHHS, the statewide organization, to be able to issue certain kinds of orders. And the local one is MCL 333.2453. They have virtually identical language, except for one talks about it from the statewide perspective, whereas the other one talks about it from more of a local perspective. So with that being said, I want to talk about then specifically the kinds of questions I've had when it comes to these types of issues that are being required of people. I had a person call me wondering about how is it that his employer could let him go for refusing to get the vaccine? Or in some instances, people are refusing to just disclose their medical information. Let's say, for example, you work at a machine shop, or you work in sales or something of that nature. You know, not even anything to do with those straw man arguments that people try to bring up about, say, people that work in healthcare, or particularly with vulnerable individuals whose immune systems are compromised, and that's the entirety of the core group of people that they serve. Not even talking about that. That's, you know, can get into a whole different level of information and debate. But what I'm talking about is simple and straightforward and deals with 98% of our workforce in dealing with, you know, the requirements to not only get a vaccine, but to disclose the personal medical information of individuals to their employers. Those are some significant issues. And people talk about HIPAA. The one thing I'm going to tell you right now is virtually every time somebody has referenced HIPAA and how it protects us, and you can't do that because you're violating HIPAA, virtually every time, it's not been relevant. With that context in mind, we're also talking about, of course, it could be the same issue with stores, for example, that are not allowing individuals in without wearing a mask or having their temperature checked, or, you know, having the COVID vaccine. So we're also dealing with that. School districts not allowing children to either attend school or play sports unless they get the vaccine, and they're wearing masks and they're using social distancing. Those are all the types of things that, again, I said originally 50 to 75%, probably 95% of you have asked this question to me already, or you have this question, one of these questions, and you're needing answers. And maybe just needing a refresher on some answers you've already received, because at times this information can be overwhelming. I mean, shoot, look how many colors I have up here. I have that many colors for a reason, to keep the information separate and distinct when I'm explaining it to you.